Good afternoon and welcome to Washington State Public Health Association's March webinar, Strengthening Public Health Governance in Washington State. Prior to getting started, we'll just go over a couple of technical issues. First, the slide on the screen should show you your control panel. All attendees are linked to the webinar in view-only fashion, and you can ask questions through the questions log. We'll be doing a question and answer at the end, so feel free to put your questions in during the course of the presentation, and I will be reading them back to the presenters. You have two options for connecting by telephone or microphone on your computer. If you receive any feedback when using the microphone on your computer, you can switch to the telephone just by clicking in the audio box on the control panel. The slides and the recording of the webinar will be available after the webinar later this week. So please send me an email, Betsy Skoda, bskoda@wspha.org if you have any questions about that. So I'd like to welcome our presenters today. Tim Teggy, Director of Member Development and Partnerships at the National Association of the Local Boards of Health, Dr. Bob Lutz, Board of Health member for Spokane Regional Health and acting co-chair of the Washington Local Health Boards Alliance, and Brad Banks, Managing Director of the Washington State Association of Local Public Health Officials. Tim?
Great, thank you very much. I appreciate this opportunity to present to all of you today. I'm going to quickly advance through this slide. It's pretty self-explanatory. My name's already been introduced. So, as Betsy said, I'm with the National Association of Local Boards of Health, commonly known as NALBO. And I wanted to just have a little background on what is NALBO. In this world of public health, as you all know, there are a number of acronyms and the alphabet soup of all the phrases and so forth. But NALBO is one that is important to public health in the area of governance. And a simple way of putting what NALBO does is we are the national voice for the boards that govern health departments. As you know, there are other organizations that work with health departments, such as NACCHO and ASTO working with state health departments, and there's other aspects of that field. We work with the boards that govern local health departments, and that is our unique niche in the public health landscape. We are a nonprofit association founded in 1992, and we were founded by local boards and state associations that represent boards of health. As a little background story, Ned Baker is one of our co-founders and was our first president and first executive director, and he was the president of the Ohio Association of Boards of Health back in 1991. And he saw in a report somewhere that the North Carolina Association of Boards of Health had received a grant to do some board training, and that was the first that he was ever aware of another state having a state association representing boards of health. So he quickly contacted the president of the North Carolina Association, and together they were interested in seeing if there were any other state associations in the country. So they did some checking, and they found about 6 different states that had a what we now call a SALBO, a State Association of Local Boards of Health. And that quickly led to some conversations and some real interest in forming a national organization, that there was a real strong interest and a real strong need to say we want governance to be represented at a national level, to have a national voice as public health evolves and emerges and develops. And so that led to NALBO forming in 1992 as the only national organization that represents the boards that govern health departments. Next slide, please. The NALBO mission is to strengthen and improve public health governance. That mission is relatively new in the way it's stated now. The original mission of the organization was to empower boards of health to promote and protect the health of their communities. The newer mission here was adopted about 2 years ago, and it is a little broader in its focus on public health governance, recognizing that there are different governance models. for local and state boards of health, and that as a national organization we want to embrace all of that, and we want to strengthen and improve all forms of public health governance. But our roots and our experience in the first 20 years has been strongly in the area of local boards of health, and we hope to build on that experience. The vision, among the vision statement, the elements that that you see on your screen there, that we believe that all boards of health should effectively and competently serve the public health needs of their community, that they should be well connected to other stakeholders in public health and in governance, and that boards of health should be comprised of individuals who have the knowledge and the skills, to effectively perform those functions of public health governance. So, that's what we work to do. That's how we live out our mission, is to try and achieve those elements. Next slide, please. So I mentioned just a few minutes ago about a SALBO, and as we are NALBO, we work with SALBOs. As the National Association of Local Boards of Health, we work with what we call state associations of local boards of health. And that is just the straight-up phrase representing that acronym. The SALBOs do at a state level what we attempt to do at a national level, which is to serve as the voice for the boards that govern health departments in a particular state, and that plays itself out in many ways. NALBO SALBOs are also, through an official relationship with us, they are considered our state affiliates, and they are very important partners in the work we do. Next slide, please. Here you'll see a map of our current, what we call current and emerging SALBOs, or state associations. The ones in red are current affiliates. The ones in blue are emerging and have not yet affiliated. We are very looking forward to that, to when we flip the switch on Washington to be from a blue state to a red state, and that means nothing political, just it's the colors we chose. But when NALBO was formed, I mentioned there were roughly 6 state associations. Today there are 14, with two more that are emerging. We have also been having conversations in a handful of other states where there is interest in forming a state association. I would like to point out that there are some states that will, are not likely going to have a state association representing local boards of health, and that is because they don't have local boards of health. There are a handful of states such as Delaware, Rhode Island, Louisiana, Mississippi, Arkansas, South Dakota, where there are no local boards of health, and so their likelihood, at the present, is zero to have a state association that represents them. There are other states where where we feel there is potential, and we are working on a lot of different fronts to to help states organize. The next slide, please. One of the things that we value is that states that are interested or that do form a SALBO, that they organize it in a way that works for them. We don't mandate that it has to be a certain way. All that we want is that the association represent the boards that govern health departments, that it be a forum for that unique aspect of public health. And toward that end, we've had a number of our 14 SALBOs that are independent 501c3 state-level associations that that represent boards of health, and that some of those include Massachusetts, North Carolina, and Ohio, where they are their own independent organization. There are several others, and this seems to be a little more of the trend recently, that are a section of another state association, and some of them are the more recent ones seem to have been organized as a section of the APHA affiliate, the state affiliate, and including Connecticut, which is our newest one. They came on board this past year. Nebraska has been around for a while, about 10 years or so, and then Indiana came on about 3 or 4 years ago as well. So those are examples of ones that are a section of a larger state association. There is another model that where the association is actually representing either the broad, the complete health department, as in Wisconsin, where it's called the Wisconsin Association of Local Health Departments and Boards, what we call WALDAB. And their leadership is structured in a way that they have co-presidents, they have co-vice presidents, and one of the presidents represents boards of health, the other represents the health officers or the health departments, and so they have shared leadership. And Michigan has a slightly different structure, but it's that same concept where it's one organization that represents the department and the boards. And next slide, please. And while the slide is changing, there are a handful of other state associations that are independent but maybe share the same staffing resources. As Colorado, as an example, they are part of an organization that is sharing administrative services as a way to increase their efficiency. In general, the work that NALBO does at the national level and that our SALBOs do at the state level, we work together. SALBOs are crucial to the work we do. They were here before NALBO formed, and they were the reason that we did form as a national organization. We have a common purpose. We have a mutual interest and a shared history, and that really drives a lot of the work we do. We include the SALBOs in the work that we do. We couldn't, because public health is so different from state to state, we couldn't be as effective if we didn't have state-level partners that were taking that information and translating it into state-specific action, or helping inform the work we do from the field, from the state, from the states to help make sure that the issues we're working on and the tools that we're developing are as relevant as possible. One of the things that we just went through this past year and a half was working with our state affiliates to redefine our agreement, the agreement that we have with all of our affiliates. And so we went through a new process to develop a guiding principles document that is the foundation for the work we do with the SALBOs, along with a new process for a memorandum of understanding. So the agreement that we have with each of our state affiliates is now going to be changing slightly. It's going to be customized more so that we can more effectively perform a role at the national level that is targeted to maximize the benefits within each state. Next slide, please. And I mentioned the guiding principles document, and what we've agreed to is that there are several areas that we both want to work together on. One of them being resource development, that we need to always be kind of working hand in hand to make sure that there are resources not only for our associations, not only for the national organization and the state associations, but that we're also looking at the resources that are there to do the work we do, to strengthen boards of health, to develop the training and so forth. So resource development is something that's very important. Membership is another aspect of it. We have a membership model where we represent all boards of health. We serve all boards of health in the country, and we provide information to all boards. But we do have a very close relationship with the boards that join NALBO, and we have a much greater exchange of information and resources with those boards, and all of our SALBOs also have a model that in one way or another allows them to do the work they do through memberships. Board development, and that refers to Board of Health development. We feel that that's part of the work we do. It's the mission of our organizations is to strengthen the boards of health. So that is always going to be an important aspect of it. Infrastructure is another area that I think in recent years has become more important. Maybe back in the 80s and 90s when organizations had more resources available, there was the greater ability to have your own staff and your own office and your own this and that. That's not as common today, and so we need to work together. How do we share some of those infrastructure, the databases and the websites and things like that. What can we do to work together to make sure that you know, we're maximizing the resources we do have on an infrastructure level. Leadership development is another aspect that is important, and that is that board members have an opportunity within their state to get involved in their state association, to advance in some leadership positions through that structure, and then to get involved in the national level on committees or on the NALBO Board of Directors. And that has been very helpful in public health as public health evolves. Even with accreditation, NALBO is very involved in the public health accreditation process and the formation of the standards and measures, and that we wouldn't have had that kind of involvement if we didn't have 20 years of local Board of Health members getting an opportunity to advance and to get involved in their states and at the national level. The last two areas that we work together on is public health policy and advocacy. And you know, I think that's one of the most important things that an association can do, is speak collectively for a particular you know, interest. And if there are issues at the state level that will affect the way that public health is, you know, that will affect governance or that will affect public health, then you know, boards of health in many cases should have a voice in that. So those are the areas that we work together in. And next slide, please. And I'm not going to go through these last. I'll go through this slide, but the next three I'll kind of condense a little bit. But some of the reasons to form a SALBO is to provide that that unified voice at a state level. You know, again, to provide the forum for advocacy and policy on important issues, to be an entity that's going to see what the training needs are and help develop those training tools and orientation manuals and so forth. To focus on, you know, making sure that there are resources available to do that kind of work, and to serve as an information exchange within the state, you know, for the people who are serving on boards of health. To provide an opportunity for board members to get together. Public health professionals get together in a lot of different settings. They have those opportunities, but the boards who govern the health departments are often, you know, they don't get as much of a chance to interact as Board of Health members, and so that's another very important function of a state association. And to access the national resources and training and information, and finally to influence the national discussion. The next slide, please. Just some of the things that NALBO does to support our state affiliates is we do maintain I guess the biggest thing is to serve as a national voice, a unified voice for our state affiliates. And that's proven to be very useful to the work that we do, is to have the collective voice of not only of boards of health but of our state associations. The peer interaction through our SALBO committee. We maintain a committee for all of our state affiliates. We have board representation, 4 different positions on our board of directors that come directly from states that have state affiliates. And we also provide staff support, a few hours a month for each of our SALBOs that are interested to have, you know, to work on any number of activities. We do provide conference registrations to help make sure that our SALBOs are in attendance. And, of course, the SALBO, we help provide access to issue experts here at NALBO and other areas and other organizations as well. The next slide, please. These next couple slides, and I know I'm going to turn it over to Bob, I think, here shortly, but these next couple slides are just some things that some other SALBOs have done, and I don't want to go through that whole list, but really looking at how creating the materials that boards need to, you know, orientation guides, training manuals, conducting surveys to make sure that the needs are being met within that niche of governance within a state. Getting involved with other state associations to help advance the cause of public health. So those are some of the things that you'll see other SALBOs have done. And I'll just go on to the next slide. That's some other examples. But I will wrap it up at this point and turn it over to Bob to continue on. And I'll
Great, thanks, Tim, and thanks for that sort of national perspective. Good afternoon again, Bob Lutz, and I'm over here in Spokane on what is today a sunny day, which is a nice pleasure. So next slide, please. A little bit of background. I just want to go over, provide you some context, and explain to you ultimately about our local SALBO. As you know, in contrast to what Tim mentioned about some of the states where we won't see SALBOs, here in our state of Washington, county government certainly has a lot of authority and remains somewhat separate from state government. And what we see within those county government structure is that it's usually run by 3 county commissioners or a legislative body. And again, state law really provides the jurisdiction for counties to provide public health and safety. Next slide. I present this. This was actually first shown to me by John Weisman down in Clark County, and if not familiar with what's referred to as a social ecological model of behavior change, I'd encourage you to become familiar with it. It's a common model that is made use of in public health, and it's oftentimes presented as concentric circles with the individual at the center. The reason I like this graphic representation of it is that it puts public policy at the base, it's the foundation. And what I believe elected officials need to understand in their capacity as Board of Health members is that the work that they do legislatively affects all of their constituents. And so if Board of Health members, again, the majority of whom are elected officials, if at some level they can look upon their legislative duties and the legislation they enact as affecting the health of their constituents, then I think it's a win-win, because that's at some level how you move to a healthier community. Next slide, please. So again, I won't belabor reading these RCWs, but as you may or may not be well aware of, there are 2 different models for how local boards of health are constructed, depending upon whether or not a county is home rule charter or without home rule charter. This explains in the RCW for without a home rule charter, where the board is composed of county commissioners, but again, they can elect to expand their Board of Health. Next slide, please. And similarly, in those with a home rule charter, the county legislative authority shall likewise establish the Board of Health, but again, expanding the Board of Health beyond the county commissioners is certainly an option. Next slide, please. I think the one caveat I should make about those previous 2 slides, however, is that understanding that the majority of elected officials, the majority of county commissioners, do not necessarily have a public health background. And I think that is just an important construct to understand, because it then becomes a essential element of the relationship between the health district, the health department, the health officer, the administrator, to at some level educate and provide that background on what public health is and what public health is all about that Tim alluded to before, that NALBO has been at the forefront of assisting boards of health in understanding that. This RCW, again, talks about what boards of health shall do, enforcement of public health statutes, ensuring health and sanitation issues in that area. Next slide, please. Creating policy to promote and enforce community health, monitoring of infectious diseases and contagions. I love the term nuisances, detrimental to public health. I love trying to find out what the definition of nuisances is, but irrespective. Next slide, please. Reporting to the State Board of Health through the health officer or administrative officer, and then fee scheduling. So again, this is how Washington State has defined the duties and responsibilities of local boards of health. Next slide, please. And this is a map It's still a very blue state, even though Tim alluded to potentially turning red at some point when the SALBO is no longer emerging, but we will remain blue. And this shows the 39 different counties, some of which have consolidated. So you'll see those up in the Northeast. The Tri-County Health District, Chelan-Douglas has also merged into a health district. And again, it's just for resources, and I know there's certainly conversations elsewhere throughout the state about more regionalization. Again, acknowledging that there are 39 counties and 35 boards of health. Next slide, please. I use the term expanded local boards of health, and I sort of alluded to that earlier in the two slides. And I just list a couple. These are actually 4 that I have had personal interactions with, but as I've learned, there are considerably more quote-unquote expanded boards of health, and it simply means that there are members beyond the county commissioners. The important thing to understand is that they all function slightly differently, and with the exception of a handful, the majority of funds for local public health come from county general funds and state flexible funds. The cities have no obligations to pay for public health, and the reality is that most don't. And so one of the issues that has arisen is that there's some tension that exists with some boards of health because of where funding is coming from and whether or not an expanded board of health that has significant contribution or input from city officials, but monies are not necessarily being provided by that city for public health efforts. So again, some tension, as you may well understand, exists. Next slide, please. A little bit of history, therefore, on what we're referring to as our Local Health Boards Alliance. It also has an acronym, but I haven't really memorized it yet, so bear with me. As sort of Tim alluded to earlier in his presentation, NALBO has national meetings, and I was fortunate to attend one of those national meetings a number of years ago when I first came on the Spokane Regional Board of Health, at which point I learned about SALBOs and also just networking, realized the potential for this in Washington State. And so myself as well as others have been in conversation with NALBO for a number of years, and we've been emerging for quite some time. But it was really at the Coeur d'Alene National Meeting for NALBO where I had the fortune of meeting Brad, who you'll hear from in a couple of moments. And at that time, we actually had a meeting of all Washington State attendees. We probably had 30 people attend this Washington get-together. And there was a consensus that something of a sort of a SALBO to be defined needed to be developed because there was just a need with continued issues around funding and really trying to have a common voice at some level with Olympia. Next slide, please. So ongoing conversations, we drafted bylaws, again, a resource provided to me by Tim at NALBO. I had a variety of different bylaws made available to me. And again, with the people that have been sort of behind the scenes leading this project, continue to expand, more conversations, more phone calls. And then it was presented at the ReSalfo meeting in November of last year at the General Assembly, at which time it was strongly supported. Next slide, please. And so if you were to look at our bylaws, what you'd see is that the purpose of our organization is at some level a information repository, an opportunity for different boards of health to get together and exchange information, coordination of policies, programs, importantly to work with WASAC or SALFO and help them understand our needs, but also look at what they're doing and how do we work together to really promote public health, disease prevention, health promotion. Next slide. Again, purposes continued. Just a space, if you will, a space holder, an opportunity for people from different constituencies to get together, to talk, different issues, but nonetheless there's commonalities, and therefore work collectively to really improve the public health system in the state, and certainly, to support those efforts that take place in Olympia. Next slide, please. And so currently, our interim organization is, we have a chair, who's County Commissioner Jim Jeffords from Asotin County, Bud Nicola, who is over in Saddle King County, who actually has been and may still be a board member of NALBO, and myself serve as interim co-vice chairs. Obviously, there's no immediate past chair, but in subsequent iterations there will be. Marnie Story has been our acting secretary from Clark County, and we do not have a treasurer as of yet. Next slide. And membership is broad. I mean, essentially, anybody who is a member of a local board of health would be considered a voting member. We're looking at, again, a variety of different membership models, but we've been inclusive rather than exclusive because we just felt it was necessary to have as many voices at the table as possible as we get started to really understand the needs and really ensure that what we're doing is representative of what's needed out in the different boards of health across the state. Next slide, please. Again, just continued membership. And that may be my last slide. If I go to the next slide, it is indeed. So I, at that point, turn it over to Brad. Thank you.
So thanks, and nice to be with you all. Very much appreciate Tim and Dr. Lutz's conversation so far. I think where I want to kind of turn this conversation is to talk a little bit about WSOLFO in the context of why we felt, as we were moving through this sort of merging process, that WSOLFO could be kind of that umbrella for this salvo for the Alliance to find its home. So the Washington State Association of Local Public Health Officials, many of you are aware of this, so I won't belabor it, but we represent all 35 local health jurisdictions in Washington State, and we serve as kind of that voice of governmental public health in particular, both here in Olympia, but at the national level in working with our partners like NACCHO and NALBO, but also work extremely closely with our state agency partners, Department of Ecology, DSHS, Healthcare Authority, Department of Health, obviously, and as well engage with many partner organizations like WSPHA, the Nurses Association, Medical Association, et cetera. And so public health, as many of you know, is very broad in its sort of capital P, capital H sense. And so we play a component of that, and really the component that I think WSOLFO represents is really that policy level component in our work, both with the professionals who make up the staffs of local of health departments and districts, but also the elected officials and board members of the various boards of health in Washington. So next slide. So you can see WSOLFO's mission. I won't say too much more about that, but I do want to focus kind of on our affiliation. We are a state affiliate of the National Association of City and County Health Officials, NACCHO, also another acronym of SACHO, so State Association. So we have, there are similar organizations to ours that exist around the country. And we're an affiliate of the Washington State Association of Counties, WASAC. WSOLFO is in fact housed with WASAC in Olympia. And the nexus there is very important, primarily because public health, for the most part, or local public health, is really a function of county government in Washington State. We're a decentralized state. We do have a Department of Health, but really most of the work of local public health happens at the local level, and is a function of county government, whether it's in the form of a county department or a district. The result is the same, and generally, and Dr. Lutz alluded to this earlier, from a funding perspective, it really is kind of a paramount county responsibility to provide that funding for the work that goes on at the local level. The state obviously has a contribution that's very important. And so because of this nexus with counties in particular, WSOLFO has an affiliate relationship with WASAC and tries to work very much arm in arm on issues that can either work to promote issues that help and enhance the public health discussion, but also to protect against ideas or concepts that could be harmful to public health, to the system in Washington State. So, next slide, please. So we just sort of alluded to that, and I think why is the Alliance part of WSOLFO? Well, WSOLFO plays that unique role of representing the local government function, and so I think creating the nexus is really why this is the starting point. You know, I think as we and many of the folks that were involved as we were trying to get this alliance off the ground, there was a lot of discussion about how it could exist. You know, is it going to be an independent entity? Is it going to be you know, a function of some other group? And again, we felt WSOLFO had the capacity, but as well as sort of the natural alliances already in place to facilitate getting this idea from being just an emerging concept to an actual reality. And so that's very much the process that we are in. And I think so far we've seen a lot of benefits by having this tied closely with our county association. We've seen a number, as Bob alluded to a moment ago, about the meeting we held in November as in conjunction with WASAC. We had about 17 or 18, if my memory serves, Board of Health members present at that meeting from around the state. So that was a pretty significant meeting for us. It was a good opportunity to kind of make a formalization of this as part of what will be going on between WASAC and WSOLFO moving forward. And so we'll go to the next slide, I guess. You know, I think why the alliance is needed so much right now, we are, I mean, and we've just seen this with sequestration. We've seen it for years with budgetary problems at the state level, but beyond just the budget conversations, the policy conversations are very much there. I mean, we've certainly seen public health thrust into the limelight as it's related to gun violence, other issues. Tobacco continues to be an area that we are focusing on, and I think in Washington State in general, as a leader in local public health work, we are working, I think, diligently to try to transform kind of the 20th century model of public health into something that's 21st century, and that's going to be an effort that's going to need to happen beyond just at the local jurisdiction level. It's going to have to happen with policymakers. It's going to have to happen at the state, and so having a body like the Alliance that can really facilitate and start to be a good starting point for that discussion between the health experts, public health experts that work in all of these departments, and the policymakers who can really help implement the change as we move into this next phase of what public health looks like in Washington State. In fact, across the country, I think the Alliance can have a very, very positive role in that. And clearly, just from a state advocacy perspective, you know, working to continue the important funding that we receive, ensuring, you know, legislative issues and policy issues can be promoted and advocated for on behalf of public health is something that, you know, obviously WASAC does that quite a bit. It's part of my role with WSOLFO. Working in conjunction with all them, but really I think also trying to engage with our other policy partners or other local government partners such as the Association of Cities and other entities that are out there where I think we need to make sure that we're harmonizing the relationship. I think it's something where we've been very silent for a long time, so the more we can elevate is kind of the term I keep using, sort of elevate this public health dialogue and the importance and the, quite frankly, widespread role that public health has in so many aspects of government, whether it's at the state or local level, is really important. And so this is another place I see sort of the Alliance. And I think the Alliance really does bridge that gap between purely a county function, because as we've heard, many jurisdictions and many boards of health include members from their cities, include private citizens or other health officials in some capacity or another. And so making sure that we really bring those different perspectives in a single place to have these conversations, I think is where we really start to see the benefit. So next slide, please. No, I guess that was it. So you know, I guess I would finish this by saying, you know, we are off to a strong start. I believe I'm extremely appreciative of those, you know, Dr. Lutz, Dr. Nicola, Maria Wood, Marty Story, a number of individuals who really worked diligently to help us move this forward. And quite frankly, I'm appreciative of the support we've received not only from administrators and health officers within the state, but also from their Board of Health members in helping move it forward. And so we are very fortunate to have Commissioner Jim Jeffords from Asotin County as our acting chair of this association. And I think we have a lot of things kind of that we're moving towards in the future, and I'd mention a couple right here. One, every other Friday, we've started every other Friday having a call, just a simple conference call, Alliance conference call, where Board of Health members as well as local public health officials are certainly encouraged and welcome to participate in that. Really just provide an open forum to talk about the things that are going on. Certainly there's an element of you know, where we are in the legislative session and what things are going on, but also to have an opportunity to talk about, you know, what is it that you're working on, you know, who's passed an interesting resolution. I mean, gun violence is something that's been there, has been talked about on this call. Medicaid expansion, as I mentioned, tobacco. There's a variety of things that I think how we make ourselves relevant to the education arena as the state grapples with trying to fill a very expensive budgetary need for K-12 education. So, you know, what is the relevance of public health on a workforce and the importance of having a healthy and present workforce? So, you know, this is really an opportunity, and we've been working on this, and it's gotten off to a pretty good start, I think, of boards of health just being able to come together and chat and just see what others are up to, exchange information, and I'm very hopeful that this will continue. We actually have one this Friday at 2 p.m. and certainly anybody who's interested is welcome to be on these calls. Additionally, I think we are wanting to move to we're instituting, I think, sort of a regular in-person meetings along with the SOLFO meetings that take place in the summer and the winter of each year or the fall of each year. So in June of this year, the WSOLFO meeting in Chelan, we've invited the state Board of Health will be hopefully, we're still working out some details, but hopefully be meeting in conjunction with us there as well to have this dialogue and work with, kind of expose the State Board of Health to the work we're doing here with our emerging salvo. And then again, holding it in the fall in November down in Vancouver in conjunction with the WASAC annual conference. So we again have that broad swath of elected officials that can be there to participate. I've been working with the Association of Cities to see how we can engage in a lot of the work that they do to ensure that perhaps we can have some sort of joint meeting with their membership as well to try to make sure we're pulling that in. So I think we have a lot of things on our horizon. Clearly, we're still trying to figure out our formal structure. I think by November is the hope to be a formalized, no longer emerging salvo, but to be the Washington, the Local Health Boards Alliance as an official organization. So, and then Tim can color in our part of the map with his blue pen, or red pen, I guess. So I think that's kind of where we are from this standpoint. Again, I've really appreciated all the partners, very appreciative of WSPHA being willing to have this conversation today, and look forward to this really turning into a very positive component of the public health system in Washington State.
Okay, well, thank you, Brad. And we have had some questions come in, and please, if there are any other questions, please submit them now. Our first question is for Tim. Does NABO have any resources for best practices and local health department communication with the governing board?
Regarding communication,
yes,
we do have some resources. I'm not sure about the best practices at this point, but I would be happy to look into that a little more and share that with the group as part of the accessing the information from this webinar.
The next question is, and I'm not sure, Brad, this might be a good question for you, was there concern about the overlap of the various organizations that are working in public health, having the Alliance in addition to WASOLFO, and if you could talk about that a little more.
Sure, I'd be happy to, and I think the short answer to that is yes. And I think this is something we talk about a lot amongst ourselves within the various organizations that work on public health matters. And I think one of the issues that has plagued public health, if you'll excuse the pun, a little bit in the past has been not really a sense of speaking with one voice. And that when, particularly as it relates to sort of state legislative activity, it's not always been clear who is actually speaking for public health. And part of that is, I think, to be honest with you, not a clear sense of what public health is on behalf of many of our elected officials. And so that's clearly work that we still have to do. But yeah, I think certainly as I was considering taking this in as a part of our organization, I had a lot of internal dialogue about, what would the role, what impact would this have on WASOLFO? Is it a decision-making body within WASOLFO? That's not the case as we've laid it out there, but is an important aspect of the work we do, and I think we would be remiss if we didn't find a way to incorporate this important aspect of the system. Now, I agree, though. I mean, I think there's going to need to be concerted efforts in the days ahead, months ahead, on figuring out how we, with our partners, I put WSPHA in that group, among others, make sure that we're distilling our messaging to a point. I think we're getting better at this, but distilling our messaging, not creating, duplicative work or conversations, and really parsing out, I think, the specific roles of each of these groups and how those then, like I said, sort of distill down into a single product that can speak for public health. And when that voice is heard, there's an understanding that it's been a voice that's been vetted through sort of private sector, public sector, elected officials, et cetera, et cetera. So I don't know if that exactly answers the question, but yeah, I mean, I think that is a real concern, and it's something that, but I don't think it's a bad concern. I mean, I think it's something we're just going to have to deal with and figure out how to best. If anything, I think there's an excitement to me, at least, in the fact that we've got interest to keep having the conversation around public health. So that's a good thing. How we make sure we use that in the most sort of effective way, I guess, is part of the dialogue that we're having now.
Thank you. Well, we haven't had any more questions come in, so I would like to thank you, Brad, Tim, and Dr. Lutz for joining us today as presenters. And for the attendees, thank you for participating in today's webinar. Our information about our next webinar will be available shortly. And I would just like to finish with that WSPHA is now accepting nominations for our 2013 Health Champions. So please join us in recognizing the excellent work in public health that's being done around the state. And you can visit our website for more information. Thank you.
Thank you.